Apkarian from his lab at Northwestern up there in Chicago. And what they're doing is researching lots and lots into nociception. As I said in one of the previous lectures, nociception's job might actually be to avoid pain, not to signal pain, as we've suggested. So what they look at is lots of brain imaging studies. And what they've found is, and again, there is some criticism of the idea that there are specific brain areas for specific things, although certainly we could say there are generalized areas. What they've found here with chronic back pain patients versus people who are suffering from more acute pain is the brain areas that kind of activate tend to be different. So this is from Hashmi, and they talk about shape-shifting pain. Chronification of back pain shifts brain representation from nociceptive to emotional circuits. So they go on to say, we observe that brain activity for back pain in the early acute, subacute back pain groups is limited to regions involved in acute pain. Whereas in chronic back pain groups, activity is confined to emotion-related circuitry. So we see this shift from this kind of more nociceptive transmission and reception to actually more brain areas involved with the affective, emotional side of pain, which is really, really fascinating. And maybe does go on to say we're seeing less of a connection of pain with the actual state of the tissue, which is fascinating. And there's quite a lot of nociceptive research from Apkarian and his lab. So definitely more down the neurocentric ideas of pain and worth putting into perspective.